Hello, my name is John Glenn Creel. I'm a Native American member of the Edisto Natchez Cuso tribe. I'm also the director, owner of Walterboro Adult and Pediatric Medicine.
First of all, I want you to tell the young people, what is your occupation? Because you're the director here of the Walterboro Adult and Pediatric Medicine, and so I want them to get a feel for what the director, as the medical doctor, does here.
Well, I'm a board-certified family physician. Went to medical school at Medical University of South Carolina. Received my undergraduate degree from College of Charleston. After medical school, I went to McLeod Family Medicine in Florence, South Carolina, and worked with Walterboro Family Practice here in town for about a year and 8 months. Also was pastoring, started pastoring my freshman year of medical school, and decided that I wanted to own my own practice so that I would have opportunity for mission outings and continue pastoring. So I opened my own practice here, I guess about 5 years ago, 6 years ago. 5.5 years ago, and we've been here since. Practice is booming. Trying to recruit a physician to come and join me. We've interviewed about 3 physicians, have 2 nurse practitioners working here with us already.
Wow, that's exciting. So listen, young people, not only is Dr. Creel a medical doctor, he's also a pastor, a minister.
We'll be celebrating our 13th year pastoring next month in March.
In March. That, congratulations. Isn't that wonderful? Well, you know, the one good thing that I noticed about it, and I'm just going to kind of veer off a little bit, was because the first thing I saw on your window was Isaiah 53:5 and 1 Peter chapter 2, verse 24. Why did you pick those 2 particular ones? I know why, but let's tell the young people why.
Well, I'm Native American. I believe that there is definitely a connection between the spiritual and the physical, and I believe that goes along with my heritage, and also the fact that I'm heavily interested in the spiritual because of my my new birth that happened a little over 23 years ago, and afterwards deciding to go into ministry, being called into ministry. I felt that the Lord was opening the door towards medicine to open more doors so that I can minister spiritually. And I've participated in many conferences, a few mission trips already where I've been able to serve both as a physician to the physical and spiritually as a minister.
Isn't that exciting? Well, let's talk about the fact of you becoming this medical doctor. Who or what was your inspiration for doing that?
I started enjoying science, I guess earth science. My 8th grade science teacher, Miss Langford, she liked me for some reason. I was what they call the teacher's pet, I guess, and did well because of the relationship I built with her. And then 10th grade high school biology, Coach Adams was a biology teacher, did real well, enjoyed the way he was teaching and getting points across as far as different lesson plans. And then I had a son later. I was a teen father. My freshman year of undergrad, I was married because of my high school sweetheart was pregnant and had a child. And so we had a son who was born with spina bifida. And because of that birth defect, we were constantly taking him back and forth to various physicians. And because of his contact with those teachers and the love for sciences, then a son being born with a disability and having been exposed to several different professions, physicians, Dr. Flowers, our family doctor, Dr. Gross, pediatric orthopedic surgeon at MUSC. Just a lot of influence, and I really liked the role that the family physician played in caring for families, sort of orchestrating professional or specialty care. And I felt like I always wanted to be a family physician.
Wow, isn't that something? Well, let's talk about, as we're sitting here and standing here, I'm thinking about all of the things that you're involved in. And I know young people want to know about balancing family life and being this physician and pastor. How do you do that?
If practicing medicine was like it was in the older days, I would not be able to do both professions and have a good family life. Today we have, of course, a new specialty which is called hospitalist, pediatric hospitalist, internal medicine hospitalist. So I'm able at our local hospital to use the inpatient care teams to do my inpatient work. I go and visit my patients and do courtesy visits. I don't charge for that. I just go to see them to make sure they're doing well. And basically, they help with the care, so it affords me more time after hours to spend with my family and ministry.
Wow. Let's talk about this being involved, as we said, with family life, but also the exciting part of being this medical physician. What's exciting about your job?
I enjoy, the reason I chose family medicine is because I get bored easily if I'm doing routines. The good thing here is I take care of patients from cradle to grave, and you never know what's behind a door. It's exciting. It's like, and then when you get the information, you have to put together the history with the physical exam, and then you have to come up with a differential diagnosis, and then come up with a treatment plan. So it's just, to me, it's like solving mysteries each day, and then also the benefit of helping someone, seeing the patient benefit from the care that you give. Of course, the Bible teaches that my people die for lack of knowledge. So as a physician, I have knowledge, and I'm able to give that knowledge to patients that hopefully turns out into good health habits and good quality life.
Dr. Creel, the last question I want to ask you about is the advice that you would have for young people, because as I'm listening to you and talking to you, I see a man of faith and a man who really wants to make sure that people are spiritually fed as well as physically able to manage. Talk about the advice. Let these young people know what advice you have for them, because you are just a wonderful man to have this interview with today.
Well, as far as the spiritual aspect, I remember when I took gross anatomy that there was a young lady in my group that was doing the cadaver dissection, and as we opened up the chest, she said, "How can people believe there's no God?" You know, and just reaffirming that the uniqueness, the design of the body, there's definitely a God, you know, that has created these bodies that can, if we take care of them, they can reproduce, and, you know, cells can grow. For example, the liver, if you lose 80% of it, it'll regenerate if you're able to promote a healthy lifestyle. But I think it's exciting to be able to practice medicine, and it's allowed me opportunities to go to other countries.
So the advice that you would tell children right now is to just be steadfast?
The key is persistent, steadfast, study, listen to your parents. You know, my father was a hard worker. He taught me to work hard. And study, you know, and studying is not doing homework. Studying is reviewing, you know, your objectives from that day and previewing your objectives for the next day. And now with the computerized systems and even the public schools, children are able to know what the objectives are, which are actually test questions. So if you prepare well, you do well. And I didn't do well on standardized tests. I had a battle with math and English. I was in resource, actually, in elementary school, but it just made me study a little harder and do more. And as a result, I was able to accomplish the MCAT test, medical college admission test, and able to get through the interview for medical school. And the gentleman the doctor that interviewed me for medical school, Dr. Simpson at MUSC, he stated, John, he said, don't be discouraged if you don't get accepted, because you know, we've already accepted 45 applicants for this year's class. And spiritually, I knew that God, this was my year that I would be accepted. And I said, I'm not worried, I'll get in, you know. And of course, last week or 2 weeks ago, he came to cover my practice, and I've been here for 5 years, and he remembered interviewing me, and I did get accepted, you know.
Wow.
Some of the disadvantages, I thought, for getting into medical school would be, of course, you know, things I had to overcome, being a minority of minorities, Native American, living in a rural area, and also having a son with a disability, being a teen parent. But, you know, after I put my focus on the Lord, He focused everything else in my life. And it seemed like my life was coming to pieces at a time, but once I put my faith and trust in Jesus, you know, everything else just came into play. And He ordered my steps.
Oh, wow.
And that's why I'm here today.
Wow. Well, I want you to say to the children the last thing that you'd like to leave them with, the very last thing. And you can look right in the camera.
Having been a high school teacher for 4 years and a middle school teacher for 1 year. And then going on back to medical school, I would encourage you to listen to your teachers, listen to your parents. Persist. If you have a desire or a passion for a career, go for it. It's the passion that will make things come to pass. If you have a passion to be who you desire to be, you will one day accomplish that.